Prime Minister of Mongolia, Ayurtun, got the first dose of the COVID-19 vaccine AstraZeneca today, launching the start of the nation's vaccination program that will enable the country to return to normal life. Highlighting that Mongolia has shifted from red to yellow in terms of risks, the Prime Minister noted the results of the lockdown. It has been exactly 25 days since the establishment of the new government. During this time, we have put in efforts to carry out work successfully based on the best international practices in a swift and systematic manner with a new policy. The public emergency readiness period ends today, putting 95% of all entities back into normal operations. During the days of the lockdown, we reached 3 important results. Firstly, we were able to take control of the virus infection. Despite initially planning to involve 411,000 citizens in testing, 523,000 citizens were tested, detecting 122 cases and 33 clusters of the infection. Secondly, the foundation has been set to launch the campaign for vaccination, and vaccination will officially start from this exact moment. Mongolia has become one of the first Asian countries to launch the vaccination. For this, we must thank our spiritual neighbor, the people of the Republic of India. And next, we have also created the foundation for recovering our economy. It should also be highlighted that vaccination will only be done on a voluntary basis. As starters, frontline workers will be involved in the vaccination. He then announced that the vaccination campaign will be completed within this year. The global pandemic has become a big challenge, testing not only national readiness, but also the intersectoral readiness and capacity for countermeasures, as well as cooperation and partnership. While Mongolia had recorded only imported COVID-19 cases for 10 months, cases of domestic transmission began to surface from November 2020. In order to control the infection among the population, the healthcare sector is actively carrying out works alongside many other sectors. To support our fight against the coronavirus infection, the government of the Republic of India has donated 150,000 doses of vaccines to Mongolia. As the Minister of Health of Mongolia, I express my sincere gratitude to the government of India for presenting vaccines as non-refundable aid. We have fully ensured readiness for vaccinating frontline workers for starters. Vaccination works will be carried out in phases, with its completion before next year. During the event, UN Resident Coordinator Tapan Mishra highlighted that Mongolia has become the first country to launch vaccinations in the region.
The UN in Mongolia must compliment people of Mongolia for their strong solidarity and cooperation with the authorities in the implementation of the restriction measures. We congratulate the government of Mongolia for securing necessary vaccines for its people. We must also acknowledge the tireless efforts of all parties, including the ministers, including the Ministry of Foreign Affairs, which has played a great role in initiating the access to the COVID-19 vaccines. It is my sincere hope that all Mongolians who wish to be vaccinated against COVID-19 will receive a vaccine this year. Though vaccines alone won't end the pandemic, there will be an extremely important additional tool in strengthening our response to COVID-19 when used in combination with other measures we know work. I would urge all Mongolians to continue cooperating with the authorities, following the public health safety measures of social distancing, hand hygiene, and using masks until we end this war, as was appealed by the Prime Minister himself. And indeed, together, we will beat this pandemic.
Thus, Mongolia has received 150,000 doses of Covishield AstraZeneca vaccines as non-refundable aid from the Republic of India, as well as 300,000 doses of Sinopharm vaccines in the framework of non-refundable aid from the People's Republic of China so far. As the Covishield AstraZeneca vaccines are to be injected in 2 doses, 75,000 people will be involved in vaccination with the 150,000 doses.